Corticosteroids are controller medications for inflammation. They reduce and control inflammation, and they are produced naturally and vital to life. The indications for corticosteroids are pulmonary diseases, acute and chronic asthma and COPD, allergies, and cancer. Two classes of corticosteroids are mineralocorticoids, which retain salt, and glucocorticoids, which are anti-inflammatory. 4 routes of administration are inhalation by mostly inhalers, oral, parenteral for mainly acute conditions, and intranasal. Typical administration is done by bronchodilation medication first, then the steroid, because it will open the airway for a more effective administration of the steroid. 6 systemic effects are appetite stimulation, which causes weight gain, hyperglycemia, which may make the patient appear diabetic, osteoporosis mainly over a long term, mood changes, which is called steroid psychosis, immunosuppression, and it may cause high white blood cell count. 4 local effects with aerosol are Candida albicans or Aspergillus niger, which is an oral fungus also called thrush, hoarseness, cough, and bronchoconstriction. 5 causes of inflammation in the lungs are trauma, which can be indirect or direct, inhalation of toxic fumes, respiratory infection, ARDS, and asthmatic episodes. 2 common inflammatory diseases are chronic bronchitis, asthma. 4 classes of asthma are intermittent, mild, moderate, and severe. Intermittent is coughing and wheezing more than 2 days a week. Mild is symptoms more than 2 times a week, as well as more than 2 nighttime flare-ups a month. Moderate is daily symptoms. Flare-ups last several days. Nighttime flare-ups more than 1 per week. And normal activities and sleep are disrupted. Severe is daily symptoms and often reduced activity due to symptoms, and sleep is disrupted. The hypothalamic pituitary adrenal axis is the central stress response system. It controls corticosteroid release, and it controls normal diurnal variation in blood levels, which is the fluctuation of corticosteroids. HPA axis process. First, the hypothalamus triggers the release of CRH. Then the CRH activates the pituitary gland that releases the ACHT. Finally, the blood carries ACTH to the adrenal gland, which releases cortisol, adrenaline or noradrenaline. HPA suppression is when the body recognizes an artificial steroid as natural and stops making it. If there is long-term use, they must be weaned off. The 2 adrenal glands are the adrenal medulla and the adrenal cortex. 3 secretions of the adrenal medulla are catecholamines, norepinephrine, and epinephrine. The secretion of adrenal cortex is adrenocorticohormones or corticosteroids. It naturally releases 10 to 30 milligrams daily. It typically peaks at 8 a.m. depending on sleep schedule. Also, steroids increase glucose to decrease effects of stress. Non-steroidal anti-asthma agents. Clinical indications: NS anti-asthma agents are to be used as controllers. Prophylactic management of mild persistent asthma. Alternative to inhaled corticosteroids with kids. And they are beneficial when combined with inhaled steroids. 3 groups of NS anti-asthma agents are mast cell stabilizers, anti-leukotrienes, and monoclonal antibodies. Mast cell stabilizers are used as prophylactic aerosol to prevent inflammatory response in asthma. Intal, or generically known as cromolyn sodium, is a prophylactic agent to treat asthma. It can prevent late-phase response in asthma episode. And it also treats and prevents allergic rhinitis. 3 routes of administration are inhalation, MTI, and nasal spray. Anti-leukotriene agents are a prophylactic control drug used for persistent asthma. They are not indicated for rescue, but are helpful in control of asthma for certain triggers. Three main medications are Singulair, generically known as montelukast; Zyflo, generically known as Xyluten; Accolade, generically known as zafirlukast. Singulair, generically known as montelukast, is a tablet form. It is a prophylaxis and long-term asthma treatment. It does not bronchodilate. Zyflo, generically known as Xyluten, is a tablet form. It is a prophylaxis and long-term asthma treatment. It is approved for 12 and older, and is a controller agent. Accolade, generically known as zafirlukast, is a tablet. It is a prophylaxis and long-term asthma treatment. It is approved for 5 and older, and it stops asthma triggered by exercise, allergies, cold air and aspirin. Pros of anti-leukotriene agents are: given orally, possible 1 per day. Good for exercise-induced asthma, and they may reduce the use of steroids. Cons of leukotriene agents are: not good solo, limited to lung administration, and they have variable responses. Monoclonal antibodies are for uncontrolled moderate to severe asthma, seasonal allergies, but not for acute asthma. Xolair, generically known as Omailazum, is a subcutaneous injection for moderate to severe asthma for 12 and older, and seasonal allergies. Corticosteroids are controller medications.